My name is Doug Mall. I was elected to the Tufts Alumni Council in 2006. I am currently serving on the Alumni Council's Executive Committee. I'm one of 3 triple jumbos participating in the summit this year, with a bachelor's degree from right here at Tufts and 2 degrees from the Dental School. But who cares about me? It is my pleasure to introduce one of our esteemed faculty members joining us here in Medford from our Grafton campus. She is a veterinarian with a master's degree in international development and holds a PhD in infectious diseases from Tufts University. She is a research assistant professor in the Department of Infectious Disease and Global Health at the Tufts Cummings School of Veterinary Medicine. She teaches and supervises graduate students. She is also the Tufts Senior Technical Lead for Africa on the USAID-funded One Health Workforce Project, coordinating and managing projects across 6 African countries, including Kenya, Uganda, Tanzania, Rwanda, Ethiopia, and Democratic Republic of Congo. The program builds the capacity of partner African countries using a One Health approach to investigate, respond to, and counter existing and future emerging infectious disease outbreaks. Please help me welcome Dr. Hellen Amuguni.
Thank you very much, and thank you for the opportunity to speak to you. As you know, with the recent Ebola outbreak in West Africa and the way it spread easily to other countries, the economic impact, it is really important to take a moment and step back and think about that. How does it affect us here in the US? And also as an academic institution, what is it that we are doing about it? Because usually the response, people are just thinking about maybe the CDC or governments, but we have been working in partnership with that, and I just want to talk a little bit about the projects that we've been doing and what we are doing so far. So he's introduced me already, so I'm going to skip that because he said that. I'm originally from Kenya, and so if you don't understand my accent, just stop me and say, hey, repeat that sentence, and I will gladly do that. I worked as a veterinarian for many years in Kenya, and I also went ahead and did my master's in international development. So sort of combining hard science with social science. So I'm a scientist as well as a social scientist. And then I went and did my PhD in infectious disease in humans. So I'm a veterinarian with a social science degree and a PhD in human infectious diseases. So I call myself a One Health scientist. Yeah. I'm an assistant professor in infectious disease and global health at Tufts, and also the senior technical lead for this program that I'm going to talk to you a little bit about, called One Health Workforce, funded by USAID. So when we think about the outbreak, we think, well, we should probably, with all the Nipah virus outbreak before that, the highly pathogenic avian influenza, and now last year, and early this year, the Ebola outbreak that got everyone in the world scared and panicked, we think about what can we do? Why do we need an integrated approach to infectious disease? Because this has always been a human element. When there's a disease, then human medical doctors respond. But we're saying no. We need to sort of have everyone being a part of it. And just looking at West Africa and what happened, there's a big outbreak going, but there's so many social cultural issues that are related to that. People are saying, we are dying, but we're not going to let you take our mother's body away. And yet that's the body that's giving someone the infection. And so when you look at that situation, then you probably need some social scientist or medical anthropologist who understands that situation and who can come in and talk together with the medical doctor to deal with that. Ebola comes from animals. You probably should have talked to some vets or some wildlife people way in advance so that it can be controlled from there before it moves into the human population. And that's sort of where we're coming from with our approach to this. We know that habitats are shrinking. You know, our population has exploded around the world, and therefore we've invaded places that we were not. We've taken over some animal habitats, you know, and so we're sharing environments. And because of that, now diseases are coming up that were not there before. Two, of course, climate change. With climate change, we have new viruses emerging, new bacteria emerging. Now probably there's malaria in places where malaria did not exist. Dengue virus has moved across different continents. In the US, we have West Nile virus that did not exist before because of that. And three, this is the biggest, probably the most scary thing, global travel. I just came in from Uganda yesterday. I got here at 3 in the afternoon, and I'm here. So it takes 14, 15 hours to fly in from Uganda to the US, and probably we know if you're a scientist, incubation period is how many days? If I'm carrying something, and I don't want to scare you, I don't think I'm carrying anything. If I'm carrying anything, by the time it shows up, it's 3 or 4 days later. So because of global travel and all these things, we have to sort of take a step back and think about these things that are happening and what do we do about them. And so we talk about the One Health approach, and I thought I would just tell you a little bit about that. That it's an interdisciplinary strategy that addresses health from an integrated perspective, not a discipline-based. Because we've worked in our silos for so long, veterinarians have done their thing, medical doctors have done their thing, economists have done their thing. We're saying we all need to sort of come together and begin to think together and lay out a strategy that can help us beat this. Because we've been thinking the same way for the past 100 years, and we have not succeeded. So why not try something else that's new and different? And so it's not a discipline, it's an approach that brings disciplines together, saying we need to work together as different disciplines. And this is usually our sort of thing, looking also at the human, the animal, and the environmental health. And a lot of the times we focus on human health. That's the end line. Everybody thinks we want to do this to improve human health. But if we are destroying our environment, we are destroying the human health. If you're not thinking about animal health, we can't control human health. Basic diseases like rabies. If you cannot control rabies in animals, you will find it in humans. So in that way, just thinking about an integrated approach that helps us to respond to that. And of course, we want to think about One Health as one of those, you know, with the Ebola outbreak last year, bringing in multi-sectoral approaches, bringing in multi-agencies, all the different teams and groups of people that will help us to fight that. One other thing that we think about is, we talk so much about adding years to life, but how about adding life to years, you know? And many times we can do that if we think of transforming global health. If we think about the health of people, this is a picture in Uganda. I take all my pictures. So this is a picture I took in Uganda. And we were talking about schistosomiasis. It's one of those infections that's transmitted across different disciplines. Thinking about young children and what kind of life do we want them to have in the end. And reducing local and global inequities in health. It doesn't matter if we are able here in the United States to provide good health care for people. If we cannot do that across other nations and other countries, it will still come to us. I can tell you that. We cannot sit in our own little cocoon and think we are protected. No. Until we think of global health equity for everyone, then that's when we'll begin to succeed. And sustainable health in a sustainable environment, thinking about animals. What role do animals play in that? You know? And one of the key things that we talk about at TAFS is actually, we know that educational institutions have 3 main key cornerstones: education or teaching, research, and community outreach. What happens, how are we able to take what we do and translate that into changing lives of communities? Because that's the key thing. We don't want to be at an academic institution and then just write beautiful manuscripts and have them sitting on a shelf somewhere. We want to be able to take that information and use it to change the lives of the people that we meet. Otherwise, I think it's useless to do that. So what are we doing about this? I wanted to sort of just take a moment and talk about 4 small projects. The main one is the emerging pandemic threat, so I'll spend a little more time on that, but also World Justice, Cummings Foundation grant, and Partners in Health. These are smaller grants. And then Tufts innovates. That brings us back to Tufts here and what we are doing about that. So the Emerging Pandemics Threat Program is one of our key projects that I'm engaged in, and it is funded by the United States Agency for International Development. Big project that started in 2009. First phase ended in 2014. We've just been renewed for another 5 years, starting 2014 to 2019. And the mandate is actually to strengthen training, education, and support to governments and universities and civil society. Why? To build the capacity of what we're calling hotspot nations to be able to respond to any emerging pandemic. Anything like Ebola, highly pathogenic avian influenza, Nipah virus, all these things that scare us when we see them. How do we build the capacity of nations to be able to prepare and respond to them? I think the key thing is that they will come. You know, the risk is always there. They will happen at some point or another. But what are the resources you need? Both human and any kind of resources that you need, and how do you need to prepare for that? And so with this, the USAID funded the EPT program, and through that, it works in Southeast Asia and Africa. In Africa, 6 countries. In Southeast Asia, 4 countries. Southeast Asia has just expanded now to add another 3 countries. In Africa, we've just expanded to add another 2 countries. So we're still getting our heads around that to be able to work in all these countries. The partners, I need to talk a little bit about that because it's not just Tufts University. We were funded together with the University of Minnesota. Those are the key US partners who are funded on this project. In Africa, we work with a network called OSEA, One Health Central in Eastern Africa. And in Southeast Asia, we work with a network called SEOHUN, Southeast Asia One Health University Network. We have WHO, the World Health Organization, the FAO, and the CDC as partners on that. And in Africa, where I'm mostly based, so I'll focus on that a little bit, the network is a network of 14 institutions. We work with universities because our thinking is that if we can transform the leaders of tomorrow, everyone coming out of university to get these skills that they need to be able to respond to this emergency, then we have graduates who are coming out well prepared to do this. So we work with our main key partner are the universities, but also we work with the governments, saying that those people who are already in the field, all those in-service people who are already working, how do we give them the skills to be able to respond to any such emergency? So in Africa, we work with 14 institutions, and we work with schools of public health or medical schools and veterinary schools. So 7 schools of public health and veterinary and human medicine, and 7 veterinary schools across 6 countries: Kenya, Uganda, Tanzania, Rwanda, Ethiopia, and Democratic Republic of Congo, and now Cameroon. And this is for Southeast Asia, 4 countries, 14 institutions, 7 veterinary schools, 7 medical schools, or schools of public health as well. Just a little bit about our team. Just put this slide there because I don't work alone, so we work with a big team of people. Our dean of the vet school, Dean Debbie Kochiva, sits on the boards of deans of these schools as well. We have Professor Zipori, who is the PI for the project. I'm the senior technical lead for Africa. We have a senior technical lead for Southeast Asia as well. And then we have faculty who actually live in the region. And we work at Tufts, although it's housed at the vet school. We work together with the School of Medicine. We work together with the School of Public Health. We work together with the School of Engineering, with the education, because it's multidisciplinary. And we feel like we need all these different departments to work with. We work with support institutions, the Tufts Institute of Environment, the Center for Education and Learning, the Center of Excellence for Learning and Teaching, and CTSI, which is the Scientific Training, Grant Writing, Research Methodology Institute at Tufts. And so 3 main key things that we do: transitioning the current workforce, talked about that a little bit, those who are in the field; transforming the future workforce, the people who are in the universities, who are going to be coming out to practice; And community engagement. How do we bring in the community? How do we engage the students that we're working with the community? How do our faculty engage with the community so that we can establish those linkages and train them together? And so one of the things we thought, just a few of the key things that we do, how do we do this? We thought, for any academic institution, you must have some core competencies that you want to be able to deliver, because we are based on a competency-based type of training. What are the key competencies that we call One Health key competencies that we want anyone that is trained to be able to have, and we can actually measure it and say, hey, they can be able to fight an emerging pandemic. We can be able to send them to West Africa because we know we've given them these particular skills. So we went ahead first and developed some of these together with our two partner institutions, OSIA and CIOHUN, and came up with some key competencies that probably, if you look through, you'll recognize as soft skills that anyone must have, but just sort of looking at those and saying, these are the key areas that we need to be able to focus on. Leadership, but One Health leadership. Leadership in the sense of One Health. How do you bring multidisciplinary teams together and work with them in that? So we identified some of the soft competencies, and then we also identified some of the key technical competencies. And so one of the things, how we do this is we said, with these competencies, let's work with these institutions to sort of review and revise their curricula so that as students go through this curricula, they're exposed to this. So we are working with institutions one by one so that our graduating students all receive training on infectious disease preparedness and response. So like in the DRC this year, we're going to graduate about 400 students, medical doctors, nurses, veterinarians, anybody in their final year of medical school or vet school is going to get an intensive 2 weeks training on emerging pandemics. And they'll get some skills and basic information on how can they identify, how can they do a little surveillance, how can they become the foot soldier on the ground if an emergency happens. And these are some of the skills I talked about, also some technical skills as well. We focus on infectious disease management. We focus on outbreak investigation. If there's an outbreak of Ebola or Nipah virus, what do you need to do? Who do you need to bring to the table? What kind of financial situation do you need to have? Who can you call as your partner to be able to respond to that? We have what we're calling One Health villages or demonstration sites, because we know that outbreaks happen in the community. They don't start at the university or with the students. They happen in the community. So how do we work with the community members so that they also become a partner and they also become a part of this? So we are calling them One Health demonstration sites or One Health villages, where we identify an area that has all these key One Health problems or issues. Maybe there's human-wildlife conflict in that area. Maybe there's an emerging disease like tuberculosis or brucellosis or something that's already happening. And then we work with the community to identify who are the key leaders, what kind of basic training can we give them so that they're also able, in their own community, to bring the disease to the information of the university as well as to the government. And this is an example of a One Health demonstration site in Tanzania. And we identified this area close to the national park where they have a lot of rabies. They have a lot of human-wildlife conflict because elephants go in and destroy people's crops and people kill the elephants in turn, you know. So to that extent, sort of identifying those problems, just beginning to work with that community as well. At the universities, we have student clubs. We've formed what we're calling One Health student clubs, and we have one here at Tufts. And the students actually go out and work with the communities and they can go out on a rabies campaign. You know, they're going out to the community to train, and they will take medical students, veterinary students, so multidisciplinary sets of students all the time, so that medical students are actually training the people on human health. What do you do about rabies if you're bitten by a dog? And veterinarians are vaccinating the dogs and explaining, hey, this is how you need to take care of your dogs. And we have some social scientists working with them and saying, hey, even though in your culture it says that dogs are good, but there's some of these diseases that they transmit that you need to take care of, like you need to vaccinate against these. So bringing together multidisciplinary teams of students to go out and work together, as opposed to the vets just go on their own The medical doctors just go on their own, and the nurses go on their own. And some of the things that we do also as support is we recognize that sometimes we are more equipped than our partners, and they lack basic skills. You know, just even in research design, they lack basic skills in other things. So saying, how can our faculty here at Tufts, and we have a great group of faculty. I can tell you the past 2 years, we had over 40 or 50 people traveling to each region to just support maybe in research methods. Maybe you're an immunologist to infectious disease, or you're a pathologist, traveling to go and support and then partner with someone in those countries to help out. Then these are just some of the things that faculty did in relation to support infectious disease, laboratory, research design, ecology of disease transmission. And what we do with our faculty is they're not part of the project, but they sign up and say, hey, I'm a specialist in this. And as we identify that need with the countries, we ask them if they can be able to go over for a week, sometimes 2, sometimes a month, and see if they can be able to support the country in that. And of course, with the government as well, we do what we call in-service training, bring people from the government, from different disciplines, and help them and provide training in that area as well. And what is the whole target is that we have One Health professionals. They're well-trained, they're mandated and equipped, you know, and they have skills. The whole idea is to have everyone getting these skills where they're able to recognize, they're able to start the process of preventing and responding as well to any emerging infectious disease, be it Ebola, be it Nipah virus or tuberculosis. And some of these diseases have been with us, and they're really re-emerging. Like I think TB is really re-emerging in a big way, and it's becoming a crisis. And the whole endpoint is that health systems benefit. If the health systems can benefit, that's to our advantage. So I just want to move from that and talk a little bit about another project that we have specifically for the University of Rwanda. And this is because in the bigger picture, we're trying to build One Health systems. But when we come down to individual institutions, you will realize that some of them, even if we're building One Health systems, they don't have the basic system in place to be able to do that. So the University of Rwanda Veterinary School is a very young veterinary school. It's about 6 years old. And the University of Rwanda Veterinary School trains veterinarians before who'd never touched an animal in their lives, and who go through vet school without touching an animal and graduate without touching an animal because they cannot go out to the field to do that. You know? So you might have a good training program or a program that's established, but I don't know that you want a medical doctor to be touching you who has never touched a patient, you know? And the same, you don't want a veterinarian who has never touched an animal to be out treating your animal. And so as we worked with them through the One Health project, we realized that this was a great need. And they came to us and said, this is a really big need. You know, and we thought, this is not funded, cannot be funded by EPT or USAID. But what can we do as Tufts? Because we realized that's a big need. And how do we fill that? And so with the support of the Cummings Foundation, and Bill and Joyce Cummings have been great supporters and been supporting us in many different ways, we said, why don't we start another project just specifically for the University of Rwanda, Nyagatare, where we can help support them. And the 3 key things they were interested in was getting their vets to go out to the field to touch an animal, building the laboratory capacity for them to do that as well, as providing like technology, like internet or a library. They have a library that's literally 1 room with 1 computer. This is the vet school, you know, so they don't really have much. But they're really excited, they're great people, they have good faculty, and they're excited about moving this forward. So with the support of the Cummings Foundation, we were funded to do a project that could help them do these things. So we worked with them, first of all, to help them purchase an ambulatory vehicle, which is like an SUV, 4-wheel drive vehicle that can carry up to 6 or 8 students, and they're able to actually go out because they're located in this area that is the livestock heart of Rwanda. You know, so they've been able, and we've been doing this for about 2.5 years now. So now they have a vehicle every week, 2 or 3 times a week. Students are able to go out to the field. They're able to touch animals, to do different things in the community, and that's really helpful for them. And good training as well. The quality of training is improving. And related to that, we are able to send our students from Tufts to go out and work with them over the summer. When we have students who are interested in international veterinary medicine, they can go out and they can link up with the students in Rwanda and they can work on projects together. We've supplied them with a drug kit because when you're starting and you're beginning to do this, you don't have medication and things like that. So just sort of stocking them, helping them stock up on medication and getting them out into the field. So I can tell you that right now I'm very excited about this project because they go out 2 or 3 times a week. And every week they send me like 50 pictures, like, oh, we did this case and we did this. And so one of the things we've established is sort of like a Skype or rotation with them. So when they go out to the field, we have our students, our vet students as well. So we can Skype together and we can talk about the cases they've seen and we can share some of the cases that we see over here. So it's sort of like an education system that we have that is building with them. So these are some of the faculty and students out in the field. This is Professor Mezan, one of the faculty from Tufts who is working on this project as well. And one of the other things we did was a laboratory. So that's one of the laboratories they had, the top left picture, and the right is also one of what they called a lab. And so we've been able to help them construct this lab. And when I was there last week, we just took pictures of the students using the lab. So that was exciting, seeing that, you know. And now when they go out to the field, they can get pictures, they can get samples, they can come to the lab, and they can work in the lab because they're able to do that. So we see it's a small project, it's focused on a school, but we can see the long-term impact of that. And of course, we have them doing some research. We funded them to be able to do some research as well, saying, okay, so let's see if we can support 5 or 10 faculty. And so we gave grants to 5 of them, $5,000, very small grants, to say, what research project can you do? So you can go out, get samples, or whatever it is that you need to do, and be able to do that. So they did that, some of that. So this is their library. Like I told you, this is their library. We are purchasing books. And if you have some books that you want to donate, we'd love to take them. But we are purchasing some basic veterinary books that they need, that they don't have, you know. And we are also, people give a lot of that, books. Every time I travel to Rwanda, I'm telling you, I always have 2 or 3 suitcases of books that I'm always bringing over. And they're very excited about it. And we don't have the latest picture, but probably I'll show you that. I don't have it now. We've just transformed the library now. We purchased computers for them. We changed the library so that now they have a setup where they can be able to go. We provided internet. So basic things that we sort of take for granted, you know, they're really helpful with this. And these are just some of the team members. I've mentioned that before. I want to mention one other project that we just started. This is with Partners in Health. So Partners in Health is a medical organization that does a lot of work in developing countries to try to attain global health equity. So Partners in Health, they're starting this, what they're calling University of Global Health Equity. And it's sort of focusing on training global health leaders, not just medical doctors, but global health, be it an economist, be it a veterinarian, anybody involved in the field of health at any level. And so we are partnering with them. We're partnering with Partners in Health, together with the Harvard Medical School and Brigham and Women's, to be partners in this University of Global Health Equity. It's funded by the Cummings Foundation as well. Cummings, Bill and Joyce Cummings have really been good contributors. They're really interested in One Health. They're interested in global health. And they've really supported this in a big way by the Bill and Melinda Gates Foundation and by the government of Rwanda. So the government of Rwanda really wants to improve health across Rwanda. And so they've focused on that. We have our first intake of 26 students who just started as part of this university. And a lot of the students are we have medical doctors, we have vets, we have M&E people, we have financial people, we have all sorts of multidisciplinary. And we are training them in global health leadership. That's the target, so that they become global health leaders. in this. And Tufts is bringing in the One Health angle because we are the One Health people. So we're partnering with them to bring in the One Health aspect, saying multidisciplinary, human, animal, environmental interactions are really important if you want to produce a good global health leader. And these are some of the students. I just put this up so you know, she's an agriculturalist, he's a medical doctor, he's an M&E specialist, he's a vet, and she works with the Ministry of Finance as an economist. So these are just 5 of the students that are part of the group, you know. And they're all doing this master's in global health delivery. We are also going to be working with the veterinary school to sort of do strategic planning, because one of the key things that we realized, as I said before, is the quality of veterinary education is very low. And so how do we link in with the University of Global Health Equity to improve veterinary education? Okay, so the final thing that I'll talk about is actually something that we're doing here at Tufts. So we can be doing all these things out there, you know, with the rest of the world, but what are we doing here as a group? How are we working in a One Health manner and doing multidisciplinary approaches together? We have, this is just for me, this year we got what we call a Tufts Innovates, and Tufts has these grants that it gives to its faculty to develop something, you know. So develop education material or something that you want to do with faculty across campuses. So we got a Tufts Innovates grant that's actually bringing together the medical school, the vet school, the physician's assistant program, and the dental school to develop what we are calling One Health problem-based learning cases. So PBL is something that's accepted across all these campuses. They all do it. But how about the One Health aspect? Because they all do it in their different universities. So we thought, how about we come together and develop One Health problem-based learning cases that can be used by students across all the different health sciences programs. So we are already working with that now. We got the grant in July, and we're working with all these faculty across the different institutions. So these are the different schools: the veterinary school, the School of Medicine, the dental school, the physician's assistant program. And we're working with information technology too, because some of this we are going to be offering through WebEx, you know, through technology. We cannot maybe bring medical students to the vet school, but how can we do it together so that they're all able to attend that? So what's our vision? This is my last slide, the global health equity. We want to be prepared and to be ready and to be equipped for the next pandemic, and also to add years to life. I'll open it up to questions. Thank you. Yes. Where are the Europeans? I think I can say that they're working in the region as well. The only thing about this project is it's funded by the US Agency for International Development. So it's funded by a US agency. But in our project, like in Uganda, in all these countries, we have people working with the EU who are funded by DFID, you know, different people working together on the same thing. So they are there. It's just that I focused more on what we are doing because we are funded directly by USAID. So, but they are very much engaged. I think, yeah. Yes.
Ebola is not in the news in the United States much anymore. What is the current level of concern, you know, in Africa and here?
So I can say that that's the way the media works, you know, like, and especially in the US, and if they hype things to protect the American people. We talk about this all the time, that if it's something that's affecting people in the US, then there's a panic and everybody talks about it. But the moment that is controlled to some extent, then you sort of forget about what's happening in the rest of the world, you know. But we can say that Ebola currently the outbreak has been controlled, you know, but Africa, and speaking from the point where I work with them a lot, is really on the alert because it hit Africa a lot and it destabilized the economy. Ebola happened in 3 countries in West Africa. 3. There's 17 countries in West Africa. But when anybody talks about Ebola, they say there's Ebola in West Africa. So all these other 14 countries that did not have Ebola, the economy was affected so badly that nobody can go to West Africa because of that. So it's still there, and it's at the top of people's minds. Everybody's thinking, how do we, and that's why we're engaged. How do we prepare? How do we get ourselves ready in case something like this reemerges? And so identifying capacity, human resource capacity as one of the things. How do we build the skills of people to be able to respond to this? Yeah. Yes.
In this work, do you work with the media and the local media, and how do you use the media to engage and inform and prepare and work with?
And so that's a very good question. When we are talking about multidisciplinary approach, that's one area we really think about, the media. Because we know that there's some of the key people who are able to communicate this information or miscommunicate this information as well. So we have the media engaged. We bring them in. When we have a group of people coming for training, we always work with the media. In 2012, there was an Ebola outbreak in Uganda, which nobody knows about because it was very small and it was very contained. And someone in the media said, for us to control this, ban all the houses of anyone who was involved with Ebola. And the villagers went out and burned people's houses, which was really, really, so you've been traumatized, you've lost half your family to Ebola, or most of your family, then you survived it, you went to the hospital, you survived it, you come back and your home has been burnt by everyone, and the villagers don't want you because you're carrying Ebola, And so that kind of a thing is one of the things like we work to, and that's why we think all the different disciplines are really, really important in containing this. Yes, sir.
I'm peripherally involved in a project in Zambia in which, in a very, very underserved, medically underserved, very impoverished area and the folks that are doing this identify teachers as the sort of the new health workers to work with identifying kids, doing triage, getting them, if they have schistosomiasis, getting them to the right person. Do you do that kind of stuff at the community level?
Yes, and that's really, really important. So teachers, church leaders, traditional healers. Like in Africa, those are really key because those are the people who are working with the community, like pastors, it's a big thing. Churches are a big thing, and every church on Sunday has over 100 people, over 200 sometimes. So those are some of the people that we are targeting in our training. We just don't want to leave it at the professional level. So we have a second caliber of trainees. Teachers are some of them, church leaders are some of them, traditional healers, anybody that we can target that we think can be able to be trained and pass this information around to the next person. Yeah. Yes, please.
Thank you so much for sharing this. I saw that you had gender on, I saw that you had gender on some of your slides. How does that play into this work that you're doing?
Oh, okay, so I like that because I'm a gender specialist. That's part of it. When I did my master's in international development, my focus was on gender and community development. And so working with this, one of the core things that we do is recognizing the role of gender in infectious disease transmission. We saw, I think in Liberia, when Ebola started, within the first 3 months, 75% of the people who lost their lives were women. And then later on, as they brought in the social scientists and all these people, they realized why? Because it's the women who are washing the bodies. It's the women who are cooking the food. It's the women who are the caregivers. And if you just think of it from a health angle, then you will not be able to deal with it. So you must be able to identify what are the roles, who does what in the community, and who can we target for what kind of training. So we focus a lot on that. And because I'm a gender person, I really sing that song, to be able to deal with it. Yeah. Yes, please.
I think this is wonderful, and I guess I'm really proud of Tufts for, I think, utilizing and playing to its strengths, which is really combining the work that's being done across different disciplines, because we have such a strong health focus, and it's happening at different schools. So the fact that we're really, I think, looking to combine efforts under the umbrella of One Health is really tremendous. Is that relatively new, or is that?
I think that's relatively new because, and I can strongly say that this has been supported very heavily by the president and the provosts, and they have these initiatives, multidisciplinary, like you can get funding if you have a multidisciplinary approach. So this is, but I can tell you that the vet school has been doing that for a long time, only that in its own little silo. Yes, so this is, yeah. Yes, please.
Are you working domestically at all to apply some of these models? And maybe support communities or communities that have greater risk for
So I can tell you that just from my own position, we have what we're calling a One Health Student Club that's based at the vet school, and now is beginning to incorporate medical schools and other departments. They just started about 2 years ago. This is a new initiative. And the One Health Student Club is actually just got funded. We, at Tufts at the vet school, we have a local clinic, veterinary clinic in Worcester called Worcester at Tech that meets low-income communities. And one of the things that they're doing, the One Health Student Club, is actually linking up with a medical clinic to be able to provide services to less economically able communities. So they've just started and they've gotten a little funding. The students are very excited about that. They're also going to schools as well, and elementary schools and high schools, sort of talk about the One Health principle. How do you work together with different disciplines? So I know it's something that has started. And like I said also about our Innovates grant, just encouraging that among our faculty to begin to think. Because it is a very difficult concept for different disciplines to think, let me now begin to work with vets, or let me begin to work with medical doctors. It's a very difficult concept to wrap around. Thank you very much.